Welcome to the deep dive. We're here to unpack complex info and give you, well, the insights you really need. Today, we're diving into something pretty critical. It touches all of us: digital health tech in healthcare. We've got this huge overview, 108 systematic reviews, actually.
Wow, it's a lot of data.
It is. It pulls info from about, 345,000 healthcare workers globally. So our mission today is to pull out the key takeaways, what helps and what stops healthcare pros from really using these digital tools.
And what's great about this body of research is it takes us past just anecdotes. We're getting high-quality evidence here. Systematic reviews, for anyone less familiar, they basically combine findings from lots of studies, gives you a really clear big-picture view. So this deep dive should really show us the common problems, but also, importantly, the solutions and the enablers.
Okay, let's get into it then. We know things like telemedicine, electronic health records. They're supposed to be vital, right? For sharing knowledge, improving care. But, well, why aren't they always just seamlessly integrated? What are the real roadblocks here?
Well, the research points to a few major ones. And interestingly, the most common barrier, popping up about 6.4% of the time, isn't super complex tech. It's actually basic infrastructure and technical issues.
Really? Like what specifically?
Think spotty network connections, especially out in rural areas, or maybe just not having the right devices, phones, tablets that work with the system.
Huh. So it's the fundamentals. It's not just having the fancy software. It needs to actually work reliably where people need it.
Exactly. The basics have to be solid.
Okay, so what's next then? What else is stopping adoption?
Well, interestingly, the next big thing is psychological and personal issues. That came in at 5.3%.
Ah, the human factor.
Precisely. This could be, general resistance to change, maybe some technophobia, or even just a feeling that these tools make healthcare less human, less personal interaction.
Yeah, I can see that. You worry about losing that connection. So how do you even begin to tackle that?
It's a huge challenge. And it ties into the next point, too, which is concern about increasing working hours and workload, reported at 3.9%. A lot of healthcare professionals worry that new tech just means more time clicking boxes, doing data entry.
Instead of patient care.
Exactly. Time taken away from what they see as their core job.
Okay, so infrastructure, personal feelings, workload. What else?
Then you've got legal and ethical factors. That's at 3.6%.
Makes sense. Privacy, security.
Yep. Concerns about data privacy, security breaches, or even just fuzziness around legal liability. Who's responsible if something goes wrong with the tech?
Right. And you mentioned one more?
The last big one we'll highlight is deficient or just plain non-existent training and education.
Yeah.
It's 3.4%. If people aren't trained properly, they don't feel confident, they might develop negative attitudes. It kills adoption before it starts.
So lack of confidence, feeling overwhelmed, basic tech not working. Quite a few hurdles. But the good news, as you said, is the research also shows what does work, what helps get these tools adopted. Let's flip to the facilitators.
Okay, so connecting back to the barriers, maybe unsurprisingly, the top facilitator is providing good training and educational programs. That's at 3.8%.
Ah, directly tackling that last barrier.
Exactly. But it needs to be the right kind of training, tailored to their needs, ongoing support, maybe real-time tech help, coaching, not just a one-off workshop.
It's almost like if you build it and actually show them how to use it well and support them, they'll use it. Makes sense.
It does. And tied very closely, also at 3.8%, is the healthcare provider's own perception of usefulness and their willingness to use it.
So they need to buy in. They need to believe it actually helps.
Yes, they need to see that it will genuinely improve how they work or improve patient outcomes, not just be another task added to their day.
Okay, so good training and perceived usefulness. What else helps?
Well, things like government and multi-sector incentives play a pretty big role, too. That's at 3.0%. Think funding, policies that encourage adoption. This helps with large-scale rollouts.
Right, the bigger picture support.
And crucially, something maybe overlooked sometimes is involving healthcare professionals in the actual development and implementation process.
Right.
That was about 2.0%.
Ah, co-design. Don't just build it for them, build it with them.
Precisely. Make sure the tools actually fit the workflow, solve real problems they face. That builds ownership and ensures it's practical.
So this whole deep dive, it really paints a clear picture, doesn't it? Integrating digital health. It's not just about the tech, the hardware, the software. It's deeply about people, about change management, about good training, building trust. For you listening, the takeaway seems to be that making healthcare better, more efficient, using tech, it really hinges on getting these human and system factors right.
Absolutely. And it leaves us with a really interesting thought, doesn't it? If we actually manage to involve healthcare professionals right from the start, if they co-design these systems, and if comprehensive ongoing training is just a standard part of the process,
Yeah.
how might that fundamentally change the whole patient-provider relationship as healthcare gets more digital? Something to think about.